And then I'm gonna hit start. Are we ready? Oh, let me spotlight you first so that spotlight. And then Joan.
Have you been taking questions as they come? Depending on if
finishing the presentation, which takes 20, 30 minutes, kind of depending on how much you want to talk. And then if there aren't any questions in the Q&A feature, I have a list.
Cool.
That Becca kind of put together, so that I can act like they're coming from this. So.
Yeah. Perfect. Okay, I am going to hit start.
Okay.
Great.
Hi, my name is Leah Costello. I'm a pediatrician at Timberlane Pediatrics and moderating tonight's discussion about COVID vaccine in our youngest eligible age range, 5 to 11. I'm here with the executive director of our Vermont chapter of the American Academy of Pediatrics, Stephanie Winters, and then I'm joined by Dr. Stan Weinberger from UVM's Children's Hospital Primary Care, who will be presenting tonight and helping to answer questions, and I'll be moderating. Please feel free to put your questions in the Q&A feature. The questions are anonymous, so nobody else can see them, and we don't know who submitted them either, so please feel free to ask whatever's on your mind, and hopefully we can provide information and help you feel more confident and comfortable vaccinating your youngsters against COVID. So I am going to let Dr. Weinberger take the floor here.
All right. Thank you, everybody who's tuning in, and for those who will be watching this in the future. I'm really excited to talk about this. We spent a lot of time in clinic talking about the vaccine and questions that people have, and I'm just happy to be able to get the word out and answer questions and help families feel like they have the information they need. So there's a number of slides, and these are the same slides that they've used in the previous forums. So we'll kind of go through, but as Dr. Costello was saying, think of your questions, feel free to type those in, and we'll kind of run through those at the end. Okay, so these are kind of the top line questions that we get, and we'll be talking about these throughout, but we're talking about the COVID-19 vaccine for kids ages 5 to 11. And what we'll kind of be thinking about is, right, does my child need to get vaccinated? What are the benefits of getting vaccination? What are we protecting them from? And what are the risks of vaccination? So first, we should talk a little bit about how COVID vaccines work. And I should say that there is, right, for adults in the United States currently, there's 3 different COVID-19 vaccines. But there's only one that's approved for children under 18. And that's the Pfizer-BioNTech vaccine. But in general, vaccines work similarly to how other vaccines that your kids receive. So what happens with COVID-19, SARS-CoV-2 is the official name of that. That's the virus that causes COVID-19. It gets inside your body, multiplies inside your body, creating an immune response that makes you sick. And so the vaccine stops this by kind of helping the immune system or teaching the immune system to make proteins called antibodies that fight off the virus. And so the idea is that, right, after you receive the vaccination, your immune system has the knowledge to make these antibodies, so that if your child gets exposed to COVID-19, be it someone is sick or they have some exposure, your immune system is primed and ready to fight it off, so that either they don't get infected at all, or if they do get infected, they won't get as sick as they would without the vaccine. And so that's the idea. And that's really how all the vaccines that we have work. And COVID-19 is not different in that sense. And so what do we know about the vaccines? And we'll go through kind of some of the data a little bit on, but we do know that COVID-19 vaccines are highly effective at stopping people from getting COVID-19, and in particular, really helping prevent serious illness, hospitalization, and death in those who get COVID-19. And, you know, that's really important, right? We know that COVID-19 has kind of taken the world by storm, and millions of people have gotten COVID-19. Some people, right, don't have any symptoms or have very mild symptoms, all the way on up to really severe illness and death. And while the vaccines provide protection from getting COVID-19 itself, it is, you know, it is possible to still get COVID-19, and we hear about those kind of breakthrough infections. But what they really do a great job of is protecting against that serious illness and death. Another question, you know, when we think about effectiveness, right, it's how well does it work? How well does it work against kind of the worst complications or the worst illness, and for how long? And that is a question that we still don't know, right? We don't necessarily know how long immunity from the vaccine will protect people. And that's because, right, it is a relatively new vaccine. It was about 1 year ago that vaccination started. It's almost been a year since I've had my vaccine, and we do know, right, that for many groups, boosters are being recommended. And so this we will learn more about as we go. So how do we know what we know, right? And in particular, how do we know what we know about this age group, right? We're talking about young kids, age 5 to 11. And so the COVID-19 vaccine, including for each age group, goes through randomized placebo-controlled trials. And so what that means, right, is they take a group of kids, and in the case of the COVID-19 vaccine for 5 to 11-year-olds, that was about, it was roughly 2,500 kids. Two-thirds of them received the vaccine, and 1/3 of them received a placebo, so not the vaccine, and it was randomized. And it was also blinded. And so then they saw, was there any difference in side effects? And was there any difference in how their immune systems responded? And finally, was there any difference in who actually got the COVID-19 vaccine? And so we know, based on that, that they work very well. Based on that trial, they were found to be about 91% effective at preventing COVID. And to put it into numbers, the 16 of the folks who didn't get the vaccine got COVID, and only 3 of the kids that did get the vaccine got COVID. But also, there was really no serious side effects. And we'll talk a little bit more about side effects in the future. Now, of course, right, that's 2,500 kids. So what else do we know? And it is true that there has been an incredible safety monitoring for this vaccine. And to put in perspective, at this point, there's been, oh gosh, the numbers keep growing. I want to say about close to 10 million vaccines given in the 12 to 15 age group. And we are approaching well, we're well over 1 million vaccines given in the 5 to 11 age group already. And so, we also know a lot about, as this is rolling out about even very rare side effects. So the Pfizer-BioNTech COVID vaccine, that's, as I said, the only one approved for kids under 18, so including that 5 to 11 year age group. And that was first approved for those 16 and older a year ago. That was extended to the 12 to 15-year-olds back in May, and just extended. There was an EUA stands for Emergency Youth Authorization for the 5 to 11-year-olds this November. Thank you. This slideshow has been updated this week. And so I was wrong. We're at 15 million ages 12 to 17 and over 4 million for ages 5 to 11. So what's different about it, right? And it's important to know that the vaccine is a little bit different for the 5 to 11 year age group. So for one, it's a smaller dose. So if you're an adult who got the vaccine, or you're a teenager over age 12 or over, you got 30 micrograms of that vaccine dose. For the 5 to 11 year age group, it's a 10 microgram dose that they tested. And what they found was that they had a similar immune response to the 16 to 25-year-olds. So that is, when they looked for those protective antibodies in kids, they found a really good similar response to that age group. And then they found that, when they looked at actually who got sick and who didn't get sick, it was about 91% effective. Importantly, actually, this was collected, the efficacy through the summer. And so we were seeing the Delta wave, right, which is that more contagious vaccine. So that is helpful to know, right? Because one of the challenging things about COVID is that it mutates and we get these new variants and new spikes in disease. And right, what we all want to know is how well does that protection hold up? And so it is helpful to know, right, that, for the kids, that testing did happen during the Delta waves. And again, they found no serious adverse events related to the vaccine. This takes you through a little bit of kind of the study. And I will say, all vaccine studies go through a phase 1, phase 2, and phase 3 testing. And so this is, the process was not different. They didn't skip any steps in the development of these vaccines. I will say though, in the beginning, right, like how did they come up with this smaller dose for kids? And they did test in their initial phase 1, a number of different dosing, and found that this 10 microgram dose seemed to provide an equally strong immune response in younger kids and have very few side effects. So then they went through and, as I said, they randomized kids, 2/3 of them to get the vaccine, 1/3 to get this alien placebo, and then they saw how they responded, looking at efficacy, looking at safety, and looking at immunogenicity. So how was their immune system responding to this based on what we know from the millions of older folks who've gotten the vaccine? So what about side effects of the vaccine? And the side effects of vaccines for this 5 to 11 age group seem to be, sort of the most common side effects seem to be quite similar to what adults and teens have experienced. So some kids will get a local reaction like pain at the site where you got the vaccine, a little redness or swelling. Some kids will get headache, fatigue, or just feel a little crummy or sick. It is important to know that those symptoms seem to be lower at this age group. And it's not clear to me whether that's the age group or whether it's because they have a lower dose of the vaccine, but they seem to have fewer of those systemic side effects. So many kids don't have any side effects at all. And those are temporary. So if you have gotten the vaccine or talked to other adults, folks often feel those side effects for a day or two. So this kind of goes through some of the real details, and I'll use my arrow here to try and point out a fewer things. But this looks at the 5 to 11 year age group, and then comparing to the 16 to 25 age group. And it looks at just, redness. About 15% of kids had some redness at the injection site. Slightly more on dose 2, 18%, about 10%, and slightly more, 15% at dose 2 had some swelling, and most kids had some soreness in their arm, about 3/4. Pretty similar to the older age group. This looks at some of those systemic side effects. So fever, fatigue, headache, chills, vomiting, diarrhea, muscle pain. And so what's notable is that, right, fever, only 6% of kids did compared to 17% of the older adolescents. Fatigue, almost 40% did compared to 2/3 of the older kids, and headache. Interestingly, and I find this is interesting, about 1/4 to 1/5 of kids who just got the placebo also felt kind of fatigued and headached. But in general, kids seem to have less of those systemic side effects. All right, so what about vaccine-associated myocarditis, right? And so myocarditis is inflammation of the heart, and or inflammation of the heart muscle, and it can present as chest pain or shortness of breath. And in the adolescent age group, there were some cases of vaccine-associated myocarditis. And so what we know from the trials is that there were no cases of myocarditis in the 5 to 11-year-olds. Now, this is rare, so it seemed to be, when it was seen, most common in that 16 to 17-year-old age group in males, not females, and really after the second shot. And even then, it was about 1 in 10,000 or 0.1%. So a pretty rare side effect, and not one, frankly, that would show up in the 3,000 kids in the test. So what do we know about it? Well, I think there's a couple of things that I find helpful to sort of just put things into context. And we do know a fair amount of myocarditis because there are a number of infections that can cause myocarditis, not just COVID-19. And so speaking of here in Vermont, we'll see a couple of cases of viral, like a myocarditis caused by a virus a year. And so we see that, and COVID-19 itself can cause myocarditis, both by itself and as a part of kind of this picture of, if you've heard of multi-inflammatory syndrome in kids, where after a COVID-19 infection, they get inflammation of a number of organs in their body, including their heart. So we see myocarditis from COVID-19 itself. And then in those older adolescent boys, after the second shot, we see some COVID-19 associated myocarditis. So to put that in context, it's helpful to know that, after the vaccine, it seems quite rare, about 1 in 10,000, and it actually is more common after COVID-19 infection. And it also seems to be more severe if you get myocarditis from the actual infection itself. The cases of myocarditis caused by the vaccine that they saw in those teens all resolved. There was no myocarditis associated deaths. And so, which is not the case of myocarditis caused by COVID-19 infection itself. And so it seems to be more common and more severe if you get COVID-19. So that's kind of, you know, the process that these vaccines go through is they then go to the FDA and the CDC, where they sort of weigh that data and say, okay, what do we know about the 5 to 11 age group? What do we know about older age groups that might help inform our decision? And so that kind of was what they were going through, as they were trying to decide, you know, does this vaccine seem safe for kids? Does this vaccine seem important for kids? It's more likely to prevent myocarditis than cause it. Another question I get asked a lot about, right, are what about late onset side effects? So, for example, totally important and valid question, right? Like, this vaccine's been around for a year, right? Like, what is going to happen? Is there any side effect that could show up a couple years from now that I would want to know about, or that I would want to factor into my decision? How do we know about that? And that's a great question. You know, and really, we base this a lot on, you know, what we know about vaccines in general and how they help our immune system respond to fight off infection. And so, you know, we obviously have a lot of childhood vaccines that we administer to kids, even starting at 6 months of age. And it's important to know that, you know, the side effects that you get, even the severe side effects, all happen quite quickly post-vaccine. So there, you know, there is a robust monitoring program for all vaccines, not just for COVID-19. And there have not been severe side effects documented 2 months after post-vaccination. What you see is kind of what you get. And that makes sense biologically in how we think about vaccines. The Pfizer vaccine, and this is a good time to talk about this, is an mRNA vaccine. And so what mRNA is you can think of it sort of like a recipe. It is not our genetic code. It's not DNA. When our body wants to, you know, make a protein with it, our own DNA, we will make an mRNA sort of recipe, and then that helps build a protein. So this mRNA does not stick around in the body. It degrades pretty quickly, which is why some of these vaccines in the beginning, you know, they had lots of challenges with storage. So that helps our body, gives us the recipe to build this protein, and then degrades. And so it also just doesn't hang around. And so it would be distinctly unlikely or unusual that there would be long-term side effects. So we know what we know, but we also know a lot from our experience with other vaccines. So what are the risks of COVID-19 infection in this 5 to 11 year age group? So, because we've talked a lot about the vaccines, right? So it's important to talk about, well, you know, what are we preventing, right? And how bad is that, to help us weigh the risks and benefits? And so what we know is there's been 8,300 hospitalizations as of early October 2021. So that's just in the last 2 months. About 1/3 of the hospitalized kid in this age group require ICU admission, so intensive care unit. So when kids get sick, they tend to get pretty sick, so that they're requiring the support of the intensive care unit. When you look at deaths, and here's deaths, there's been about, I believe, 500 or just over 500 deaths in the under 18 age group. When you look at the 5 to 11, that's 94 deaths. So they're in a relatively low, you're more at risk if you're under a year of age, or as you get older, approaching 17, 18. However, it's important to put that into context. So, kids 5 to 11 generally aren't supposed to die. That actually, 94 deaths makes COVID-19 the 8th leading cause of death right now for kids 5 to 11. So that's pretty significant. This is some data from Vermont, and you can find this on the Vermont Department of Health, that kind of gives us an update of sort of where are things here in Vermont, right? Like what's our situation? And you can see, things were really good over the summer. And then as we got into August and then September and particularly November, things really spiked. And so this orange bar is the total pediatric cases compared to all cases. And this breaks it down just looking at kids. And so this kind of purpley bar is the age range of this vaccine, the 6 to 11 year age range. And so it's important to know cases in Vermont are going up, and the proportion of cases caused by kids is also going up, which makes sense, right? We have pretty high vaccination rates in Vermont, and kids are a huge group of folks still really susceptible to the vaccine. This looks at rates, and so that those kids age 6 to 11 have the highest rate of kids vaccinated. And so, they are getting sick with COVID. Sometimes it's really severe, and they're, even here in Vermont, where we have high vaccination rates, those are the kids most at risk. So it is really exciting that we have this vaccine that can potentially protect those kids. Where does Vermont fit in compared to the rest of the country? So this is cases per 100,000 children. So it kind of puts it into population context. And we're pretty good. We're kind of in the lower half at 9,000 cases of COVID per 100,000 children. This looks at proportion of kids age 12 to 17 who have received at least one dose of the COVID-19 vaccine. And Vermont is kind of neck and neck with Massachusetts at 83%. And so we've had really high uptake of the COVID-19 vaccine, not just with adults, but also with teenagers. All right, so what about, so we talked about COVID-19, that it can cause a lot of hospitalizations, that it can cause some deaths. What do we know about pediatric COVID pneumonia? So pneumonia is infection in the lungs, leading to low levels of oxygen in the body, may require hospitalization for oxygen, and may also require support in breathing. And that's kind of, one of the feared complications, right? And when you think about adults who are dying from COVID, that's mostly related to pneumonia and lack of oxygen and infection in their lungs. This is a slide around severe COVID cases among adolescents. And right, we are lucky in that our adolescent vaccination rate is quite high. And so while we're seeing, right, COVID spike everywhere, the 12 to 17 age group has a lower rate of rise than those 6 to 11-year-olds, in large part because they have some protection from the vaccine, right? So they're not getting infected, and they're not getting as sick. So again, as we said, the vaccine provides some protection against getting COVID, but there are still breakthrough infections, but you're much less likely to get really sick. And this shows this is national data. But just looking at unvaccinated adolescents are 10 times more likely to be hospitalized due to COVID than vaccinated adolescents. So this is just a little bit about multi-system inflammatory syndrome in children. So this we've been seeing in kids. And so this really is a syndrome of kind of whole body severe inflammation affecting multiple organs in the body after COVID infection. Sometimes, even as you have had a recent COVID infection that you've gotten over, and then you have this inflammation in your body. And this can present incredibly severe. There's been about 6,000 cases in the US and 52 deaths from this particular syndrome. And this is most common squarely in that 5 to 11 year age group. So while the 5 to 11 year olds have a lower rate of death, they have a higher proportion of this multi-inflammatory syndrome in children. So this looks at just kind of some epidemiologic data around, what are the benefits and what would we hope to prevent? And so for every 1 million kids who receive the COVID-19 vaccine, you'd be looking to prevent somewhere on the order of 57,000 cases of COVID, about 200 to 226 hospitalizations, about 130 cases of MIS-C, that multi-inflammatory syndrome in kids, and 60 to 70 ICU admissions. There's a little bit difference because males tend to have more severe disease than females with COVID. And so that kind of, gives you a ballpark of what's the benefit that we get from the vaccine, or what are we preventing? So then it comes down to weighing risks and benefits of vaccination. And this, kind of talks about sort of the process, because this is what the FDA goes through as they authorize that emergency authorization. And it's helpful to know kind of their decision making, right? And they look at both the risks, what are the excess cases of myocarditis? And they very specifically looked at that because that was, a known rare risk in teenagers, compared to what are we preventing? COVID cases, hospitalizations, ICU stays, and deaths. They, in that analysis, did not really take into account the severity of myocarditis. That vaccine-associated myocarditis has a more mild course and shorter stays than if you get myocarditis from the actual vaccine. And they're really looking at risk benefit for the children receiving the vaccine. So they're not looking at the benefit to others, that vaccinating our children might help protect other folks in the household who would be at higher risk of bad COVID. And they don't look at, the disruption to in-person learning or things like that we know have had huge effects on kids. So I think that's helpful to know. The FDA is really looking at a very small slice, but of course we know that COVID has really had this huge disruption in our families, in our schooling, in our kids' lives. And that's important to take into account as we're thinking about, like how comfortable do I feel about this vaccine and about, the protection and safety that this vaccine can offer my kids. And so that was their voting question based on the totality of the scientific evidence, and the FDA approved it. A couple other slides, but one, this is a great question and one that I get all the time, right? Why is the vaccine based on dose, based on age and not weight? So remember, if you are a 12-year-old, 12 and up, you get 30 micrograms of the vaccine. This 5 to 11 year age group, they got 10 micrograms of the vaccine. Now, of course, some 11-year-olds are the same weight or more weight than, heavier than some 12-year-olds. And so why the difference? And importantly, vaccines are not a medication in the sense that, they're triggering our immune system, helping teach it to respond to a certain infection, in this case, the COVID-19 vaccine. So it really doesn't depend, like most medications, you need a certain amount of medicine to get a certain amount of level in your blood. And vaccines really don't work that way. And so rather than weight, what it really depends on is your immune system response, right? And so younger kids' immune system usually needs less prompting to respond. And so as they were, testing out different sort of doses or, amounts of the vaccine, they found that, yeah, in this younger group, they seem to respond well to this 10 microgram dose with very few side effects and a really good, strong immune system response. And there seemed to be pretty good response, among that 5 to 11 year age group. So it wasn't like the 5-year-olds were totally different than the 11-year-olds. And we know that as we get older, our immune system actually becomes less responsive. And that's why many kids have much better responses to vaccine dosing. That's why, frankly, although boosters of the COVID-19 vaccine are now recommended for all folks age 16 and up, we know that the older you are, the more likely you are to really need a booster. Another question I get a lot is, okay, I have some kids under age 5, right? A 2-year-old, a 4-year-old. What about them? So clinical trials are underway, going down to age 6 months. So in general, as I've heard how this is working, they're looking at the 2 to 5-year-old age range, and then 6 months to 2 years. And similar to the kids we were talking about, the 5 to 11-year-old, they're testing smaller doses in those younger kids because they tend to have good immune system responses. So trials are underway. When will we know? I don't know the answer to that. I have heard sometime later this winter. It really depends on, the trials, right? So getting the appropriate number of kids that age in the trial so that we'll know how well it works. If there's not a large enough number of kids, then we can't say with any degree of certainty how well it works or how safe it is. And then waiting, so they give a number of months so you can tell, so you can look for those side effects or things like that. What about getting other vaccines at the same time, right? So before COVID-19 came along, right, the most common preventable cause of bad respiratory illness and death due to respiratory illness was the flu, right? Influenza. And every year we recommend influenza vaccine. We are recommending it again this year. Last year was interesting. There was less flu, presumably because we were being so careful, right? Schools were hybrid, people were masking, we just weren't getting out as much. This year, we're kind of bracing for a worse flu season. And it's really hard to predict, but there's a whole lot of folks who didn't get flu last year who are, have lost some of that immunity or protection to flu. And we're just back out in the world more than we were last year at this time. And so we're bracing for flu, and we recommend getting a flu vaccine. And it is okay to get the flu vaccine with the COVID-19 vaccine. It is okay to get your other vaccines at the same time. So they can be done at the same time or at a different interval, depending on what works for your family, but there's no problem with that. And we totally recommend getting kids up to date. The COVID-19 vaccine, and I think people know this, but this is important to reiterate. So the 5 to 11-year-old age group, I guess I didn't say this, it's a 2-dose vaccine. So it's a smaller dose, it's at 10 micrograms, but the schedule's the same. So dose 1, and then you wait 3 weeks and you get the second dose. And then you seem to kind of have that full protection about 2 weeks after getting the second dose of the vaccine. And that's just because it takes some time for your body to, get exposed to the vaccine and mount that immune system response. And so that seems to be when, sort of when you're protected. It's not right after that second shot. COVID vaccines are free, so health insurance doesn't matter. And how do you sign up? So the Department of Health offers a number of clinics, and you can go to healthvermont.gov, my vaccine, to sign up for any of those. They also have school located clinics, and you can sign up for those at that same website. Many pharmacies also have pediatric vaccine. And again, it's a different vaccine. And so, if you're calling, you'll want to ask. And then pediatricians and family medicine clinics also have vaccine. So for example, we have vaccine in our clinic, and I know most of the other pediatric clinics here in Chittenden County and around the state also have that. I will say supply is limited. We wish we had more vaccine, but it's coming. So call, really, I think it's important. You have some choices so you can have the vaccine in whatever place feels most comfortable for you and your child. Here's the phone number. So that website again, and this is the phone number that will also get you to the Vermont Department of Health sign up. Here is some other resources. And again, this talk is recorded, so you can see these slides and see on these pages. Healthychildren.org, this is from the American Academy of Pediatrics, and they have great information on a huge range of things. So they have some great information on the COVID vaccine, but really it's just a great website to know and to bookmark for any of your health needs, questions that you have about kids. And of course, ask your pediatricians and your family medicine docs. Talk to the people who you trust. I think that is all. Yeah, questions, answers. I should say, I think I strongly support the COVID-19 vaccine. I think, I also feel strongly that all parents should have whatever information they need to feel comfortable in their decision. And I really am just happy about that opportunity. I should say, I'm a pediatrician. I'm also a parent. I have 2 children who both fall squarely into this 5 to 11-year age group, and they both received their second vaccine last week. And so, on both a professional and a personal level, I care a lot about this topic.
Dr. Weinberger, thank you. I agree. I also have 2 of my 3 children fall squarely in the middle of this category, and we were very excited to get their second vaccine last week as well, and looking forward to when the younger kids can be vaccinated as well. I did realize at the beginning that I forgot to introduce Joan Pellerin, our ASL translator. Thank you for joining us. She has committed to all of these sessions, which has been fantastic. We really appreciate it. Stan, thank you. We have some great questions coming in, and I hope that we can take some time to go over them. But I just appreciate your time, and I think that you really, some of the questions are around age of the vaccine, just the change in dose from the 5 to 11-year-olds to the 12 and ups. And you did a nice job talking about how really is based on the immune response. But I think people are curious that, what if my kid turns 12 in a few weeks? Should I wait and get the full size dose rather than the 5 to 11? And then kind of on the flip side of that as well, what if I have a really tiny premature 5-year-old, a 5-year-old who was born prematurely? Is that 5 to 11 dose safe for my child?
Yeah, that's a great question. And I think, well, I have a couple thoughts in response to that. One, so we, what we know is that, right, there's been, and I saw that updated slide, right, about 4 million doses given in this 5 to 11-year age range, and as you look up into the 12 to 17-year age range, it's 15 million. And so within those age brackets, right, those are premature kids, those are kids who are, relatively small for their age or relatively large for their age. And so there's a lot of variety. And so I think, we can say pretty comfortably that kids in that age range, the vaccine seems to be effective and safe in that age range, regardless of sort of their size compared to their peers in that age range. The other thing I was going to say, and then the corollary to that, right, is that COVID is around us, right? I mean, we wish that things were better right now, but rates are high in Vermont and across the country, and the 5 to 11-year kids make up a huge chunk of those new infections. And just like everybody else, we have those same fears about what's coming down the pike and new variants. And so, as I talk to families, I say, given that we know it seems safe and effective, I would not wait to vaccinate. You could wait a couple months until your child turns 12. However, they might get sick in that time. I actually, I know of more than a handful of kids who have gotten COVID while waiting for their vaccine date to show up.
I agree. I give the same advice to my patients, that get it as soon as you can. That's the safest and most effective way to use the COVID vaccine. The other series of questions that we're seeing is also around kids who've had COVID in the past. Should they get vaccinated, and what should the timing be related to their previous COVID infection? And are there risks to a kid who has antibodies from the infection and then gets vaccinated? Can something such as immune complexes happen?
Yeah, and that is a great question. And so that does not seem to be the case. And I will say, one of the interesting things about COVID, and one of the things that made, when you think about how these trials have gone through, right, and how they've been able to both enroll kids and have data, is that COVID is so common in getting so many people sick that both in the trials and since, right, you've had people who have had COVID and had the vaccine in some order or another. And so, no, there do not seem to be, I should say that there have not been sort of trends in the data or reports that I've seen that about any negative side effects from getting the COVID vaccine if you've already had COVID. The other thing that is interesting is that, if you get sick with COVID vaccine, there does seem to be some window of protection where you're not so likely to get infected again. Now that may be changing, right? As we have these new variants, it seems, you know, you may be at risk of getting infected with a new variant, but that natural protection from, or that protection from an actual infection seems to wane, and it really doesn't last that long. And so, so in fact, we are totally recommending that even if you've had COVID vaccine, the best way to have kind of longer term protection is to get the vaccine. Now, I will say the recommendation is if you are sick with COVID, to not get the vaccine while you are sick with COVID. And so the general recommendation is, you know, to wait, because you have to isolate for a period of 10 days. That seems to be how long most folks are sick and contagious. And so wait till that period is done and you're feeling better. But then, yes, you can get the vaccine.
And I've been giving the same advice in that we aren't, we really don't know how long immunity from infection lasts, and that the vaccine really offers the longer term and more robust immunity to an infection. The other great questions that we have on here tonight are around myocarditis, and someone asking about, my child has a heart murmur. Should we think about this more? Are they at higher likelihood of vaccine-induced myocarditis? What advice would you give to that family?
Yeah, great question. Yeah, and so so my advice would be to vaccinate, but the real reason is that you know, so right, and you're talking about, you know, heart murmurs, there's a whole spectrum of things, and it would sort of depend on you know, what that specifically was. But we know that, for example, kids who have severe heart problems, they are some of the kids who are going to be most at risk if they get sick with COVID, so really severe COVID. And so that's why, you know, for those kids with complex medical needs or special health needs who might be immune compromised or have some other severe disease, you know, not only does the vaccine seem safe, but they seem to, I mean, they would be the ones we would be most worried about should they get sick. And, you know, from what I have heard from the cardiologists, and there was a cardiologist who reviewed all the myocarditis data actually at the FDA meeting, and that was their conclusion as well. But the other thing I would just say is, you know, regardless, if you have any questions about your own child's personal medical history and what that means for the COVID vaccine, please talk to your doctor. We all welcome those questions and want folks to talk to the people they feel most comfortable with if they have a question.
I love that advice. It is true. We are really excited to share information about this, but also talk to our individual patients about their certain situations. I spoke with our local cardiology group about this when I gave a presentation in November, right as the vaccine came out, and they told me that the National Pediatric Cardiology Society was really behind this vaccine and strongly recommending it for all of their patients with complex heart conditions. So from the most complex to the more minor in their world of just heart murmurs. And it was really reassuring to me as a physician to be able to tell my patients that pediatric cardiologists really stand behind this vaccine and recommend it for all of their patients. And I've also been reassured that so far, with the 4 to 5 million doses of the vaccine given, that we have not had reports yet of myocarditis come up, or at least not that I have heard of yet. And so that's really good news that these younger kids just are at lower risk for myocarditis, most likely. So, and I also actually, when people do ask a little more about that, help to counsel a bit on what we know about myocarditis, which is that we do see spikes in the incidence of myocarditis in the youngest infants, and then the older teenagers because we actually see myocarditis after other illnesses as well. And most specifically, we see myocarditis after an infection with COVID. So the vaccine itself reduces your risk of getting COVID and therefore actually reduces your risk of getting myocarditis, in kind of my opinion and my understanding of just the risk of myocarditis with the vaccine versus myocarditis from COVID infection itself. The last question we have here tonight before we wrap up is just around boosters. If this vaccine is so effective, why are we needing boosters so soon after? Why, so, just 6 months after getting your second dose, do you need a third dose of the vaccine? And will younger kids need that as well?
Yeah, that's a great question. And I think we're still learning more about that, right? I think, there's a couple factors that come into play. And I will say, in the world of COVID vaccines in the world of vaccines for kids, many of the vaccines, if not really almost all the vaccines that we give, usually have a regimen of a couple boosters. And what that does, as your immune system sees that vaccine and remembers that response, it tends to have an escalating immune system response. And so you build that memory for longer. So if you think of, some of our other vaccines, some have a really good response after just 2 shots, the original shot and a booster. Some require more, but it depends. So this is not necessarily totally unusual, but also it's hard to know, I think at this point, what's that going to mean? I mean, it seems like immunity wanes, and so a booster at some point is probably likely. Immunity seems to wane more the older you get. So, I imagine, like as they found, the oldest age group, those over 65, seem to be the folks who, you could tell first that they needed a booster. And then, as the data became more clear, it became more clear that, well, most adults seem to need a booster. And I would suspect that we will see that with the kids, but I don't know. Kids' immune systems are different than adults' immune systems, and we'll have to see.
Thank you for that. Any last closing words that you were hoping to share with the folks watching tonight or watching the recording in the future?
Not really. I thank you. Thanks for tuning in. Thanks for listening. I think this is a really exciting development to have this vaccine, to be able to protect kids in this age range. And I know as parents, right, we want to have all the information that we need so that we can feel comfortable making decisions to protect our kids. And so thanks for tuning in. And please continue to ask questions and advocate for your kids.
Thank you, Dr. Weinberger. Thank you, Stephanie Winters. Thank you, Joan Pellerin. And thanks to the American Academy of Pediatrics Vermont chapter for putting these on. And thank you for your time tonight, participants, and those of you listening to the recording.